Did you know that during the peak of the COVID-19 pandemic, some regions reported up to 10 times more cases and deaths per capita than others? What caused such dramatic differences? Today, we explore why certain areas were hit harder, revealing the complex web of factors that shaped the pandemic's impact. One of the biggest puzzles of the COVID-19 pandemic is understanding why some communities suffered disproportionately while others were less affected. From densely populated cities to rural areas, the virus did not spread evenly, leading researchers and policymakers to investigate the key drivers behind these disparities. Could it all come down to luck, or were there deeper systemic factors at play? The answer may reveal more about our world than just the virus itself. Several factors played crucial roles in how COVID-19 impacted different regions. Population density determined how easily the virus spread, with urban centers becoming early hotspots. Access to healthcare was also critical. Communities with fewer hospitals or overwhelmed facilities experienced higher mortality rates. Government responses varied widely, from swift lockdowns to delayed measures, which drastically affected the course of outbreaks. Socioeconomic status added another layer. People in low-income areas, often employed in essential jobs, were more exposed to the virus and had fewer options for remote work. Racial disparities also emerged, with marginalized communities experiencing worse outcomes due to pre-existing health conditions and limited access to medical care. The pandemic exposed vulnerabilities that had been hidden in plain sight. Perhaps the most striking case study comes from New York City, where neighborhoods like the Bronx reported nearly double the death rates compared to wealthier areas like Manhattan. While both regions are within the same city, access to quality healthcare, differences in population density, and the types of jobs people held played significant roles in the disparity. In contrast, countries like New Zealand managed to contain the virus early by combining strict lockdowns, rapid testing, and effective public messaging, demonstrating that swift, coordinated government action could make all the difference. The pandemic didn't impact everyone equally. It amplified pre-existing inequalities and showed how factors like healthcare, government policy, and economic status influence public health outcomes. COVID-19's uneven impact serves as a reminder that a one-size-fits-all response to crises is not enough. What do you think were the most important factors in shaping COVID-19's impact? Share your thoughts in the comments below. And if you want to explore how communities are recovering from the pandemic, check out our latest video on post-COVID rebuilding efforts.